In this video, I'm going to be talking about lung issues related to radiation therapy. We had a question about radiation fibrosis, and I'll be covering that. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. Often our content is in response to a question and request that you, our viewers, have had. So radiation therapy for breast cancer, the current treatment planning is very good at avoiding the heart and the lung and normal tissues. But sometimes the field, it is very difficult to avoid radiating some of the lung. This is also the case if other parts of the body are radiated. If somebody has a breast cancer metastasis to the bone and the spine is radiated or the rib is radiated, sometimes the lung is included in the radiation field. So it's not just breast alone, breast radiation alone, but it can also be radiation to other parts of the body. So when radiation affects normal lung tissue, it generally does one of two things or both. Early on, it can cause inflammation, and things that are inflammatory end in the suffix itis. So gingivitis is inflammation of your gingiva. Dermatitis is inflammation of your skin. Meningitis is inflammation of the meninges, or the lining around the brain. Damage from radiation therapy to the lung is called radiation pneumonitis. There's inflammation in response to that energy that's given with radiation therapy. Over time, things that are associated with later and longer term effects end in osis. So pulmonary fibrosis. There are other things that sclerosis of the blood vessels, that's what we see with thickening of something. So pneumonitis occurs early, usually in the first few weeks or maybe a month or two after radiation is done. And radiation fibrosis occurs later on, many months or years after radiation therapy is complete. Let's talk about radiation pneumonitis first. This usually presents or shows up, as I mentioned, pretty early on after radiation is complete or even towards the end of radiation therapy, and people generally have a cough, shortness of breath, and sometimes even fever. And it is very closely tied to radiation therapy. An X-ray will show some inflammation or whitening on the X-ray. A CT scan will show the same thing right in the radiation field. So it often has sharp lines to it. It's not fuzzy or filling up the whole lung. Rather, it follows the exact radiation field, and the radiation oncologist can help say, yes, that's exactly where we radiated. So we can see that in people who've had radiation therapy, and it's quite easy to identify. How do we treat it? Well, as I mentioned, it usually starts towards the end of radiation therapy. If it starts earlier on, radiation therapy will be held and actually even reconsidered, because we don't like to cause, of course, severe damage to normal tissues. But in people who are diagnosed at the end of radiation therapy, it's actually quite easy to treat with corticosteroids like dexamethasone or prednisone. These medications are very cheap and very effective with almost immediate symptom relief. If somebody's been undiagnosed with radiation pneumonitis for a while, it may take a little bit longer for them to feel better, but the prognosis is excellent with no expectation of permanent lung damage. I do want to say, in case somebody's watching this and had taxane like Taxol, paclitaxel, or docetaxel, Taxotere, that we can sometimes see radiation recall. So what Taxol or Taxotere can do is cause the area that was previously radiated to act up again, and you might be diagnosed again with radiation pneumonitis if you're put on a taxane. This is really rare, but that's actually why it's helpful to tell you about it. Radiation fibrosis is a more long-term and late effect. This is very uncommon with current treatment planning. It is very uncommon, and it is seen more in people who have larger areas of the lung radiated, and it's often seen even a couple decades later. With this, shortness of breath and decreased lung capacity happen because this is a scarring of the lung. Of course, this is quite serious. We have a great deal of lung capacity in our bodies. We can donate a lung. You know, people can live on only one lung. So it's not It's not as serious as it might sound. It's not a bilateral, it doesn't affect all the lung, both lungs, unless somebody's been radiated to an extremely large part of, for example, the spine. And even then, we're really good now at avoiding that deep radiation. It really stays within the bone. We're very good at having radiation where we want it to go. So more common is radiation pneumonitis. Again, this is pretty uncommon, but if you've had it, it happened in you, and then it happened 100% of you. So I hope this is helpful. If you've had radiation pneumonitis, we'd love to hear from you. Share your experience with the Yerbba community. We see you. You're important. As always, thank you for watching.